So even though I'm telling you what's black and white, when you actually go do the activity, I want you to be really in tune with, does this activity provoke my pain or is it uneventful? If it's uneventful, it's fine. Okay.
So basically if I do planks, like I haven't been doing planks because I was worried that might kind of aggravate it. But if I wanted to do some core work and just do planks, you think pain should be my gauge?
Pain should be your gauge. Yes, absolutely. In fact, on top of doing things normally and using pain as your guide, I want you to do what's called the flexion series. Because you have that bias, it's going to help your body to heal a little bit faster. So you're going to focus and concentrate more on the exercises and the stretches that help to kind of relieve it. And that would include lying on your back, hugging your knees into the chest, doing pelvic tilt. So I'm going to run you through sort of a little protocol that you can use for this episode of acute discomfort.
Okay.
Okay. Tuck your hands under your knee. Mm-hmm. And now I want you to try to kick your right leg away from you while you're not letting it move. So you have to kind of meet your own resistance. Okay. Yeah, good. So do you feel a little bit better now?
Now I don't feel it.
Okay. Maintain that. And then lift your left leg an inch off the floor. Just an inch. Hover and hold. 2, 3, 4, 5. Rest. Hands under the thigh. Under the knee. Yep. And then do it again. Push and lift at the same time and hold. 2, 3, 4, 5. Rest. Draw your right thigh in close as you can. Really, really hug it in. So it's almost like you're in a big lunge or, like a split stretch. And then same thing. I want you to hover your left leg up and try to push your right thigh away from you and push hard. 1, 2, 3, 4, 5, and rest. Hug both knees into the chest, stretch your lower back. Rest your feet down, and then just do a full bridge and notice if your left PSIS feels better. Bridge up.
Yes, it feels better.
It does?
Mm-hmm.
Great. Flip over onto hands and knees and do cow stretch. Mm-hmm. And do you feel it?
Mm-hmm.
It's better?
So it was out. That's what's causing the pain then.
Yeah, it's out. Okay, lie on your stomach. And then, we do provocation testing, treatment, and then retest. Prop up into the cobra like 3 times, but keep your hips down. This is kind of the most.
Yeah, it's much better.
Awesome. One more time, press up.
Yeah.
And rest back down. Okay, great. So you just fixed your own pelvis.
Okay. Mm-hmm.
Perfect. Okay.
Not quite my legs.
Yeah, it's going to feel like really low, but if you can scoot your right foot forward a little bit more, okay. And you might have to prop up with your hands on the bench. You don't have to lie on your stomach totally.
Okay. Yeah, that is.
Just as long as you feel like you're in a really good lunge split.
Yeah,
okay. This is easier to self-correct now. What you're going to do is press your right foot down into the ground and your left thigh or knee down into the mat, into the bench, and hold that isometrically for 5, 4, 3, 2, 1. And then when I say rest, kind of sink down a little bit to make your lunge deeper. Right there. Don't move, and then push your right foot, left thigh down again. 1, 2, 3, 4, 5. Sink down a little bit deeper. Every time you do that contraction, you want to go further into the barrier where there was an issue, okay? All right, press right foot, left knee down again. 1, 2, 3, 4, 5, and then rest, relax, and then brace core to return back up. So in that position now, do prone cobra again. Let your belly relax, keep your hips down, press up and down.
Yep, it's better.
Good.
So the pain is because the pain is from the pelvis is tilted, and so it's causing like a pain.
It was, yep, it was out of alignment. So it sounds like your SI joint, which is where that PSIS part, it's like the big rounded part of your pelvic bone, connects with your sacrum bone, the triangular part. You must have jarred yourself on the bike or something, which caused your pelvis to rotate back. At least that's what we're correcting now. I don't know if it was different before, like you had said, it's kind of been changing, but and when that happens, you've got like little cartilage pieces, you've got nerves, you've got muscles that can kind of get pinched or irritated. And so what you just did is self-corrected it by unlocking it and getting it back to its normal position. So that's called muscle energy technique. So that in combination with therapeutic exercises will help you to now stabilize that position in your pelvis that we just corrected. You have to do the therapeutic exercises to stabilize it, to prevent it from going out again. All right, so you should be sort of supported from head to tailbone. And the reason why I like the foam roller is because it wobbles a little bit. It doesn't let you cheat. First, do a posterior pelvic tilt. You're going to tuck the or back down into that mat, into the roller. Does that feel good?
Yes, the tilt feels good.
Okay. And then relax and release. Don't do an anterior pelvic tilt, that irritating position. Just do neutral or like relaxation. Okay. So you're going to do it again 5 times. Tuck, hold, 2, 3, and relax.
Okay.
Tuck, hold, 2, 3, relax. Tuck, hold, 2, 3, relax.
Okay.
2 more. Tuck, hold, 2, 3, relax. Tuck, hold, release that tuck like 5%, just barely release it, and then engage your core abdominals as firmly as you can. Pretend someone's going to punch you in the stomach.
Okay.
Poke your lower abs to make sure you feel the firmness. Are they really tight?
Yes.
Okay, good. Keep that contraction on. Turn your palms in. Lift your right knee up above your hip, 90-degree angle. Freeze. Lift your left arm up to the ceiling, 90-degree angle in the shoulder, and freeze. Okay, good. So see how it's wobbling a little bit. All your core muscles have to turn on.
Okay.
And switch. Then lift your left leg and right arm. Lower and switch.
It's kind of like doing a bird dog.
Exactly, but it's in a supine position on your back, which favors flexion, lumbar flexion, and it's protective and stabilizing to your SI joint. Yes, you want to do this 10 times. The number one goal is total stillness in your core, abdominals, lower back, pelvic floor, while you're breathing.
Oh yeah, breathing.
And you shouldn't feel any pain with this. If you do, then we've got to recalibrate and change something.
So if I did feel pain, most likely I've tilted out again.
Correct. Yes. Okay. Just like we did in plank.
Okay.
Now, rest your arms down, rest your feet down, relax your belly, take a deep breath in and a full breath out. Tuck tailbone, brace core, super, super tight. No walk or rocking as you open your right knee out to the right side, like 3 inches. Bring it back in and switch. Yeah, no wobble. Left knee opens out 2 to 3 inches. Bring it back in and switch. You want to alternate this hip release 10 times. When you rotate your hip out and in, that challenges the SI joint, where the PSIS is. So as long as you're tucking and bracing and engaging all those stabilizing muscles, your SI joint won't be able to get out of alignment again.
Okay.
You're just concentrating and zeroing in right on those joints to activate that stabilization. A lot of times your core can shut off too with an injury. So it's kind of like a retraining. And then relax your belly, take a deep breath in, exhale, tuck and imprint completely down into the roller. So tuck, 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 lift your right knee and your left knee up above your hip in 90 degrees. Hold on to the floor just to balance. Okay. Don't let your lower back arch at all. Tap right foot down to the mat. Lift and switch. Left foot taps down. Lift and switch. Good. No pain, right? Just dropped a glass of water. Good.
I gotta be mindful of time because I gotta get on this call. All right, we
Okay.
we basically have a minute.
Yeah, we're good. Just do the foot taps 10 times, keeping your back super flat. That's going to keep all of that engaged and give you that flexion bias. Okay. Rest your feet down, roll off of the foam roller. Just push it out of the way and then hug both knees into your chest, double knees to chest stretch. So those are what you're going to do to practice. And I'll send you a video. It's for flexion bias. I'll send you my video as well. I'll send you a copy of this and some instructions on recapping what we did today. So you know exactly what to do.
You're awesome.
Okay. Text me, email me if you have any questions or concerns after you're done with your workday.
Thank you.
You're welcome.